Hey, ladies and gentlemen, welcome again to Brain Gist. It's been a long while. Today, I want to continue on the series of reasons why someone who's got headaches would need a head MRI scan. I actually made an earlier video around Christmas time about this, about one of the reasons why people would need a head scan if they've got headaches. And I promise to make further videos to expose some of the other reasons why the neurologist may want people with headaches to undergo a head MRI scan. So before I go into today's video, I'd like to welcome you back again and thank you for watching the channel always. It's Brain Gist is a channel where we educate people about the brain and its disorders. So please do stick around. If you like the content, subscribe, share, and of course, also leave your comment behind. So today's video is going to be a continuation of the previous one about reasons why people would need a head MRI scan. And the foundation is it's very common that people come to the clinic and they think they might need a head scan. And then sometimes when the doctors say you don't need a head scan, some people are not satisfied, some are irritated by the fact that the doctor says you don't need a scan. And then for some other people who say they need a scan, they're worried. They say, no, if possible, I don't want to do any further investigation. So how do you actually know who needs to have a head scan? So you can check the previous video and see what I've said before, and then now today I'm going to be taking it further. And what I'm going to talk about today is one of the other red flags, and this is about a change in the pattern of headaches. So this is one of the things we look out for when we take history in the clinics, and when we talk to people about headaches. I think the most essential thing is the history, the details of the history. Like I said before, close to 90% of all we need to know what's causing the headache in any particular case is the history. The properly tailored questions, help us unravel what might be causing it, and then we decide who needs to be scanned and all of that. So I remember interacting with someone in the past who had headaches. And after I've asked them a lot of questions, they got pissed off that I was just asking a lot of questions. But then the truth is, the bulk of what we need to make diagnosis in headache medicine, and in fact, all other endeavors in clinical medicine, is the history. And that's why when you approach us or headache expert, or indeed any physician who knows about headaches, you must be prepared to render as much detail about your headaches as possible. That is pretty much more important than any scan. So if we find out in the history that there is indeed a change in the pattern of your previous headaches, then that is something that points us in the direction of a possibility of needing a scan to unravel what's caused the change in pattern. So I'm always looking out for that. So it's very usual for me to ask, if I ask somebody who's been getting headaches for many, many years, and they come into my clinic, and the question I ask them is, you've been getting these headaches for the past 15 years or 10 years or wherever, but now you're coming to the clinic. Why are you coming to the clinic now? What are your goals? And then you may realize that maybe the headaches have become worse, either in terms of frequency. Maybe they were getting it once a month before, and now it's become, much more frequent. Maybe it's become weekly or multiple times a week. Then you realize there has been a transformation in terms of the frequency of headaches. And we'll try to run through the history and try to see and explore if we can find explanations for why the headache numbers have suddenly increased. And if we do not have any explanations, then such an individual is very likely to have a head scan I might be sending them for a head scan to kind of unravel the reason for transformation of the headaches. And the scans are not always positive, actually. I assume not more than 5 to 10% of scans will come back abnormal. Most people would have a normal scan at the end of the day. So you're still back to the clinical judgment and science to decide what to do to get the headache numbers down and make people feel better. Now, besides increasing headache frequency, the other thing would be changing location of the headache and the type of headache. So I remember one of my patients who used to come to me before with headaches affecting the entire head, which with the treatment we put in place for him, it got better. And then it came back several months down the line with worsening, and now the headaches are now here in the front of the head. And that's completely different from what the previous headache used to be. And further questioning, I got other pointers to possible sinusitis, and then we asked for a scan, and we found out that it's called sinusitis, and he was sent to the ENT doctor, and then they treated the sinusitis, and they got better, and that new headache disappeared, and we went back to the previous old headaches. So that's one example. The second example is, I remember a Filipino lady with a long history of headaches, almost 10 years history of migrainous headaches. And they went to the emergency room with a new type of headache. And then, of course, the emergency doctors thought, because of how busy they are, they thought, oh, since this person is known to have migraine, this must be just their migraine headache. And they treated it as migraine headache. They got better, went home, came back again within a few days. Headaches bounced back. And then they treated it again as migraine. And then the third time the patient came back, then they realized, okay, there must be something else wrong. And they called me to see. And then during history, again, the history is very essential. Like I said, during the history taking, I realized that this headache is very different. This time around, the headache was showing severe worsening when they stood up. So they couldn't stand. Most of the time they were lying down to feel better. So I realized this must be one of the causes of positional headaches, what we call headache due to low pressure within the brain. And then we asked for a special protocol of head scan, and then we're able to unravel the cause and then treated it, and she got better. So the point is, again, even the history guides, because when we do a head scan, there are different kinds of scans. So this kind of patient, if I hadn't asked for a particular protocol that would show me what I'm looking for, the head MRI scan could have come back normal. So it's not a blind thing we do. So the history is still essential. So when I go that history, suggesting that they may have low pressure within the head, causing the headaches, and we had to ask for a special type of scan with dye to help look for, features of low pressure within the brain. So this is all I have to say today, and that's in summary, the fact that if you are experiencing a change in your pattern or usual pattern of headache, or a sudden increase in headache numbers, then something might be wrong. You may need to see your doctor for evaluation, and you may be needing some scans at the end of the day. You may or may not need one. So thanks for listening today, and I appreciate it. If you like the content, please don't forget to subscribe, share, and leave your comments behind. And of course, like the video. I appreciate that. Thanks for watching, and I'll see you next time. Thanks.